Sometimes I wonder how OBGYNs who identify as pro-life are able to provide informed, patient-centered care. Because for me, working within a reproductive justice framework isn't just a belief system, it's how I do my job. I've taken care of patients in some of the most complex and heartbreaking scenarios. I've provided prenatal care and even performed a C-section for a patient who was just 10 years old. And I've also provided abortion care for patients that young. If I were pro-life, I generally don't know how I would have been able to navigate those situations without causing harm. I've had patients arrive to the emergency room in the middle of a pregnancy loss, bleeding heavily. And my first instinct is to help stabilize them, and that sometimes means performing a DNC to save their life. So there isn't any space for personal judgment, only compassion and clinical expertise. I remember having a patient in the ICU with a rare condition that caused her to have severe blood clots, sometimes blood clots even in her brain. She was in her early 20s and pregnant, and the pregnancy actually worsened her condition, increasing her risk of having more strokes and potentially even dying. Supporting her meant helping making the safest medical decision, and that meant ending the pregnancy. And she was able then to live because she had an abortion. And she was already a mom, so she was able to stay on this earth to be there for her kid. There are so many scenarios I faced where centering the patient, not my personal beliefs, was the only ethical and clinical path forward. And I could talk for hours about the different ways reproductive justice has helped me show up with compassion, clarity to care for my patients. Because at the end of the day, my job isn't to control my patients, it's to support them, to offer every option, to honor their dignity. And I just don't know how someone with a rigid pro-life stance can do that without crossing the line into harm.